Okay, so we're going to do the joints. This is a shoulder, so you know the names of the bones first. Humerus, clavicle, scapula. When you look at the scapula, you need to know the two processes. So at the end of the spine is the acromion process, and then the other one is the coracoid process. So this is the clavicle, and the two ligaments that deal with the clavicle always put clavicle at the end. So where this is the acromion process and this is the clavicle, this, right, is the acromioclavicular ligament, acromioclavicular. Now this one down here, because this is the coracoid process and this is the clavicle, this is the coracoclavicular ligament. Okay, so if the clavicle is in the word, always leave it toward the end. Now, this one here is the coracoid, this is the acromion, so this is the coracoacromial ligament. This whole thing is the articular capsule because it encapsulates the whole joint. And then right here we have the coracohumeral ligament, and this is the glenohumeral ligament. Okay. For the elbow, make sure you know the three parts: humerus, radius, and ulna. How do you know? Well, first of all, this radius has this little bump on it right here, and the ulna has the olecranon, which is the right here on the elbow. So when you look at it in the front here, this is the annular ligament, and then when you look at the sides here are the collateral ligaments here. So when you look at the collateral, you come down here and you say, oh, it connects the humerus with the, wait, what is this? Oh yeah, it's got the nose or this little bump, radius. So this is the radial collateral ligament right here. When I go on this side, it goes from the humerus and then it connects to, wait, what bone is this? Oh yeah, the ulna. So this is the ulnar collateral ligament. With the knee, okay, you should see that this is a right knee because this is lateral. Okay? So we have the femur, the patella, the tibia, and the fibula. So we just did collateral. Let's do that again. The collateral is on the side. So here's the fibula. So fibular collateral ligament. This one is broken. Is the tibial collateral ligament. That's easy. Not bad. Now this is the patellar ligament. It goes from the patella down. This one here is the tendon of quadriceps femoris. Right here you have two little hockey pucks right here. The one closest to the tibia is the medial meniscus, and the one closest to the fibula is the lateral meniscus, because fibula, L for lateral. And then in the back, you have the cruciate ligament. Because we're looking at the back, this is posterior and this is anterior. So now when I show you, this is the posterior cruciate ligament, and this is the anterior cruciate ligament, because it's going towards the front. The hip. This is the ligamentum ligamentum capitis femoris, the ligament at the head of the femur. What you need to do is remember the bones. Ilium, pubis, because it's pointy, see? Ischium, there's a C there. Remember, ischium has a C in it. And femur. So when you look from this side, look at the greater trochanter, and you'll see that there's this big one right here, and there's actually two. When you have these two, they go from the ilium to the femur. These are the iliofemoral. I'm going to keep my fingers on here. And then when you look back here, see how this is the ischium? It's kind of circular here. So, and this is the femur, so ischiofemoral. This one's not, because this is iliofemoral. In fact, I recommend that you keep your fingers on there. This one, here's pointy, this is the pubis, this is the femur, so here is the pubofemoral. And then you also have the circular fibers of the articular capsule. The other part of these green things are bursae, B-U-R-S-A, bursa. So bursae is plural. So here you have the spine. Oh, here's the acromion process. So this is subacromial bursa. Here is the coracoid process. So this is the subcoracoid bursa.